All right, so today this is going to be the first visit after the eval for adhesive capsulitis. So what I'm going to do is I'm going to go ahead and take Heather through a couple of different interventions that we would do for that for the first visit. And then after, she's going to go ahead and take me through some interventions through when there will be a few visits later. So first thing we're going to start off with, I'm going to have Heather go ahead, you can lay on back. We're going to start off with some soft tissue. And for this, what I'm gonna do is just kind of break up some of the adhesions here. So it shouldn't be painful. If you feel any pain or anything, let me know. It should just be nice and comfortable for you, okay? So we're gonna go ahead, just in this area through here where the capsule is, we're just gonna just go ahead and break up some of that through there. And then we would do that for about 8 minutes. And then what we're gonna do is go ahead and increase the blood flow to the area. So that's what we would start off with first. Second, go ahead, you can sit on up for me. Actually, sorry, I'll sit for you. All right, what we're gonna do is some active assisted range of motion. Active assisted range of motion. And what you're gonna go ahead and do is you're gonna use this ruler here to help you try and increase your range of motion. We're gonna start off with you bringing it, oh, actually it's your right arm. You're gonna start off bringing it up as high as you can, but nice and comfortable. I don't want you to take it to where it's painful, okay? So go ahead, you can try that there for me. And then when you're at the top, hold it for about 5 seconds. How does that feel? Fine. Feels okay? All right, so we would do that for about 10 times. All right, yeah, that's about 10 right there. So next, what you're gonna do is you're gonna bring it out to the side into abduction. Same thing, hold it for about 5 seconds at the top. Don't take it to where it's painful, just nice and comfortable for you. There you go, how is that feeling? Feeling okay?
Not too bad.
Not too bad. Good. So the next one we're going to do is external rotation. So take this from you. What you're going to do is have your hand on the side. Make sure your arm's nice and tight to your side. I'm going to put a towel there so this way you can keep control of it there. Bring it out to the side. Same thing, hold it for about 5 seconds. Take it into that nice comfortable range, okay? How is that one feeling?
This one hurts a
Hurts a
little.
little bit? Yeah, that one's gonna be a little tricky, but just take it to that nice comfortable range. Don't take it to where it's too much and it's painful for you. All right, good. Okay. So that's what we're gonna do for the first session. We're gonna go ahead and finish off with some electrical stimulation for pain. Okay, so actually I'll have you go ahead and sit in this chair right here. Put this underneath your arm there so you can support it. So what we're going to do is we're going to do high rate 10s. We're going to do a frequency of 120. We're going to do it for about 15 minutes. So we also will put some ice on top of it too. And we're going to make sure that we cross these wires here. And then what you want to feel is you want it to be nice and comfortable. So you don't want to take it to where it's painful, but just a nice and comfortable setting for you, okay? Right to where you can feel it. All right, then we ice over top of it. All right, so then let me know when it's nice and comfortable for you. So strong but comfortable, no pain. There. All right. So then we bring this down to 15. Start it, and that would be it for the day.
We are just a few visits out with adhesive capsulitis with this patient. And what we're going to start with is ultrasound because we want to work on the anterior lateral pain in this region. to start, and hopefully it will improve her range of motion. We'll work on some range of motion exercises immediately following this thermal continuous ultrasound. So I'm going to set her up at 1 megahertz on continuous duty cycle for that thermal effect. And I'm going to put the intensity about 1.2 as long as the patient can tolerate that. And we'll do it for 8 minutes. Got the patient draping here. Gonna be a little cold. Sure is. All right, so the main goal when I start this is you probably won't feel any heat for a few minutes, but you should feel a slight heat after a few minutes. But it shouldn't feel any. It shouldn't feel too intensified, okay? So you just let me know.
Yep, that was pretty good.
And stop one. Now I'm going to have you lie on the table here. On your back, please. I am going to be working on range of motion with you. It's going to be a little bit uncomfortable, but it shouldn't be too painful, so you kind of just let me know. I'm just going to take you through some of these motions that we're struggling with.
Say about right there, yeah.
Kind of get a good infeel here. Is that okay?
Yeah, it's okay.
So we'll just go through this for 8 to 10 minutes. I'll do flexion, abduction, and external rotation with the patient.
Yeah, about right there.
Do each of these for a few minutes. How's that feel?
Right there.
Okay. While we're here, research shows that posterior mobile and adhesive capsulitis, so that's basically I'm pushing your shoulder back just slightly. Really it helps with that range of motion for your external rotation, that motion we just did. So what I'm gonna do is just do an ever so light kind of push on you here, okay? I would do grade 1 or 2 right now with the patient because she's still in pain. But if she could tolerate grade 3 as we progress through visits, I would do that. You okay?
Yep, that's fine.
Okay. So I would probably do that for 3 to 4 minutes. And then now, patients with adhesive capsulitis also have scapular problems with scapular dyskinesia. So the scapula could be winged. So I'm going to work on the active range of motion with her scapula as well to help hopefully fix the problem for future so this does not come back. So you're gonna stand up for me. And I'm gonna come behind you. Ideally, I would have her in a tank top so I could see her scapula. And we're gonna go straight out. Yep. And go to about where you can. Okay, and then come back down. And I'm gonna kind of hold her scap. And when she goes out, work on the rotation. So go back down. I'll try to do this 10 to 15 times for patient tolerance. One more time. Does that feel okay?
Yep.
Perfect. If she was really flared up, we could end with heat as well. And that's what we would do. Thanks.